Okay, so I get this question a lot. What is upper cervical care? Well, in a brief explanation, upper cervical care is a form of chiropractic that specializes in the upper part of the neck. Okay, why is that? Well, because here's the head. Brain sits here. Out from the head comes the brain stem, which extends down to the bottom of the second bone, then a spinal cord the rest of the way down. Well, the brain stem literally controls every function in your body. It's like the switchboard operator between your brain and the heart, the liver, the lungs, the kidneys, the arms, the legs, even back up into the head, face, and neck. Now, if one of the bones in the upper part of the neck got misaligned to the point it actually started to compress the brain stem, that would interfere with the normal transmissions from the brain to any one or multiple parts of the body. Well, wherever those particular pathways were going, that part of the body would not get the full energy or mental impulse from the brain, thus would start to malfunction, possibly even go into some sort of a disease state or result in some sort of a symptom. Okay? Now the other thing that happens is important. The head sits on top of these two bones. Anywhere one of these bones go, that head has to go with it. It doesn't have any choice because it sits right on top of the first bone. Well, the brain sits in here, obviously. Brain's design, it's got to be level to work right. Has its own reflex called the righting reflex. That purpose of that righting reflex is to make sure that head stays level or parallel to the ground. So if one of those bones got a little out of its normal position, through the brain off balance, the brain would respond by sending messages down to the body, telling the body to compensate or change to the head levels. So this can start a chain reaction through the body of twisting, turning, bending, rotating, whatever it's got to do till that head levels out. So as a result, you can end up with compensatory changes in the neck, upper back, lower back, down into the legs, knees, and feet. Now, over time, gravity pushing down, just going through normal motions, those compensations can become weak spots that ultimately can turn into neck pain, back pain, arm pain, hip pain, leg pain, foot pain, knee pain, etc. So that pretty much sums up why, as upper cervical doctors, we focus all of our energy and time on figuring out exactly what's going on here in this area because it's so vital to the rest of your body and your health.
That was perfect.